notice from my vantage point here on the stage that there's loads of people at the back of the room. You're probably looking for a seat. Good news, over here, quite a few seats, and they're all in first class, so no need to sit and coach. First class seats available, far side of the room. Come on in, make yourselves comfortable. Next up today, let's take a look at the remarkable market-leading innovation that is just one of the many whys for Personify. With much more now on the innovation piece, please welcome Chief Commercial Officer Kirk Rosin. Have fun.
Thank you. Good afternoon. It is such a pleasure to be here, an honor. And as I think about this, this is one of those lucky St. Paddy's Day moments for me. I never thought that I would be in a room with hundreds of forward-looking innovators that want to change a system that desperately needs changing. We are all here for a purpose, and as I think about that, I have to kind of pinch myself sometimes that I'm on the stage. There's an emotional support coyote over there, and we're trying to think through kind of where are we in terms of healthcare. And for me, I do have to pinch myself because I grew up in a place that was not the Bay Area, was not New York, was not Boston. I grew up in a town called Frankenmuth, Michigan. If you haven't been there, Frankenmuth is known for three things. One, world-famous family-style chicken dinners. Secondly, it's the home to the world's largest Christmas store. Yes. And third is the Bavarian architecture. And I'm not kidding. It looks like somebody scooped up a town in Germany and just plopped it in the middle of Michigan. And so for me, growing up there, it was really unique. It was a small town, and so the people made it great, and there was a lot of pride in community. And as we're thinking about kind of how all that comes together, it was incredibly impactful for me because I got a front row to healthcare in that small town. I saw with my dad, who is the family practice doc, the opportunity that his engagement with his patients presented. And as I saw him interact with his patients, as we walked through the grocery stores, as we kind of went through, it was something where he was the access point. He was healthcare for so many of those individuals. And that sense of community and that pride, driven by all those people working together, he made just a tremendous impact. And what he drove home was the fact that healthcare was incredibly personal. Doctors know families, patients know their doctors, they see them wandering around, and the impact of good care was evident as he kind of walked through and cared for those thousands of families. Which brings me to the point that, for me, my why is my dad. And for him, he was a physician for 55 years. And we always joke that, hey, he's never going to retire. And he held true to that. So he was in office on December 29th of last year, and he passed away on New Year's Eve. For me, that was incredibly tough, but he served his own life, and he lived for his patients and his medicine. For him, he took care of all of his patients. He delivered babies. So the majority of the Frankenmuth High School graduates from 1990 to 2006, my dad delivered. So it's one of those things where he was so instrumental. And as we thought through him and how he would interact with his patients, he went above and beyond. He did house calls. He went and he actually hosted weight management support classes in our living room from 7 to 9 every Wednesday. And so for all of us, that was his service, his calling, because for him, he understood that there was a whole lot of system that was out there, but if he could make healthcare personal and show up for his patients, it was a completely different experience. I also had the pleasure of watching him go through a lot of the system changes. He struggled with managed care as it came through in the late 80s and early 90s. It started to impact the way that he practiced medicine. He wanted to spend time with his patients. He wanted to have conversations. But he got to the spot where, in order to make ends meet, he had to churn too quickly. And so for him, that concept of caring for people started to dissipate. It was a fog that rolled in for him. He became increasingly dissatisfied with his solo practice. And when he got to the point where he said, look, I'm not making any money. I am having to borrow from my kids' college fund to pay my nurses, something had to change. And so he went through and he was thinking, all right, so what can I do next? 26 years he had his own solo practice. And from that point forward, he said, I am going to train the next generation of family physicians. So for 30 years, he trained the next generation. And when he started to teach in that environment where managed care was prevalent, he did start to bring the fact that, healthcare is not abstract. It's not claims data. It's not something in terms of a trend line. It is exactly who is in front of you at that point in time. So for my dad, understanding that and understanding that the system was never built for patients, it was always built for healthcare as a structure. In order to make the difference, you had to break through that and serve as that access point for everything else. So for me, that is my calling. As I think about the thousands of patients that my dad impacted, I think about the hundreds of family physicians that he trained. I think about the hundreds of thousands of patients that they're serving in his style. It is now my torch to take that forward and start to create a system that works for everybody. And so that is, as we think through where we are today, we have a very broken system. As we think through employers and what they're facing, they're seeing cost increases that are going through the roof. And what's behind that? We have Medicare, Medicaid rates that are being held constant, and so we have organizations that are trying to shift costs to the commercial side. That's the reality of where we are. We're seeing employers stepping into the role of the fiduciary differently. We have more options, and as we thought through kind of the PBM evolution that's happened over the past few years, we're starting to see that within the healthcare space too. And so that is where, for us, it's an opportunity to align, be more flexible, be more transparent, and really help those employers as they think through who can execute my strategy versus buying something off the shelf. There's also a movement towards consolidation. As we think through where we've been over the past 15 years, it's not uncommon for employers to have gone through and brought on 20, 30 different point solutions. As we think through what that means, it's just more fragmentation. And I think with all of that, it's incredibly challenging for us to communicate that, make sure it's being utilized, and we try to push it forward that way. So for us, there's a big movement towards how do I make it simpler, and how can I communicate it in a way that's effective and drives utilization. Next, there's an expectation, we hear this loud and clear, you need to deliver on your promise. Do what you said you would do, show me that you did it, and invest so that you are my partner 10 years from now, not just today. As we think through kind of where we are from an industry perspective, the intent, the good intentions, that no longer cuts in terms of where we are as an organization. We actually have to deliver results. And so for us, as we think through all of the ROI that's put out in the market, it has to be really defensible. Run the report on exactly when this person started and when they ended and what was the difference. We need visibility into whether the programs that are out there are working. So for us, this is a point in time that I want to bring a little bit more relevance to. By show of hands, how many people have been in a room where the word unsustainable has been used to describe where we are healthcare cost-wise? A little higher for me, please. Thank you. Thank you. And I think, I think out to the Princess Bride, and there's the quote of like, hey, you keep using that word, it does not mean what you think it means. That's exactly where we are. And so when I think about that, that has been the topic of conversation for the 30 years I've been in the healthcare industry. So at what point will it actually be unsustainable? At what point are we tipping? And so when you think about where we are, and you think about the extrapolation of costs, I want to just challenge all of us because we are on the precipice of a number that's really, really scary. When you think about the increases that we've seen over the past couple of years, and you apply those to where the employer cost for a family of 4 is, we're going to cross the threshold into $50,000 in 6.5 years. That's 2 RFP cycles if you start thinking about it. That's the amount of time you have to dramatically change the trajectory of healthcare in this country. That is coming quickly. And so as employers are thinking about why now, why are we going to start to do things differently, why do we need to innovate today, how do we need to link our strategy to that outcome, we're in a spot where it has to happen now. Trend is a factor of 2 things. It's unit cost and it's utilization. And we believe that we are in a unique spot to impact both of those as we work across entire populations. So we think about what's going on. Massive, massive cost increases, and there's a lot going on because health is declining. Everybody's aware of these issues in terms of obesity treatments, as we think about cancer, as we think about behavioral health needs, as we think about chronic conditions worsening, all of that is going on right now. And that is translating into cost increases that we haven't seen historically. So 9 to 10% increase year over year. And when you look at where we are from a GLP perspective, 836% increase year over year. Something's got to give. We also have stop-loss markets that are coming in 25, 30% increases. We have reinsurers that are actually exiting the market because they say, we don't have any limits. We have no way to control this. So as we think about where we are, we've got rising risks. We've got widening waistlines. We've got hypertension. And as we think about the progression, it doesn't all happen at once. It happens through emerging risk, moderate risk, and so you have somebody who develops prediabetes, gains weight, and then is hypertensive. And all of a sudden you have somebody who used to cost $4,000 is now costing $20,000. When you multiply that over population, that's exactly where we are. So as we think about innovation and we think about where we are as an organization, we will ask the question, why us? But when I think about the question in this room, I think of that we are in a room of innovators. We are in a room of individuals that are trying to figure out for their own employees and the industry all at the same time. And so you are here to think big. You are here to think in ways that will challenge where you are today and hopefully where you will be 6.5 years from now. For us, that time is now. So I'm less interested in asking you the question, what sessions are you going to go to? I'm way more interested in what are you going to take away starting today that's going to change the trajectory of healthcare for you, your family, and your organization. For all of us, we are in a spot where we as an organization are in a unique spot. We engage broadly across populations. We have a massive engagement engine with our platform. And as we think about how all of this comes together, it isn't just for somebody who needs it. It isn't just for somebody just in time when something hits the fan. People go because they want to stay healthy. People go because they want to find out about themselves and other health interests. So for us, we have this advantage when all of these things are within one experience that we can move the needle. And you'll hear about the innovations starting tomorrow in a way that we are incredibly excited for. But we're starting from a great spot with all of these things coming together. And they do impact overall health and overall healthcare spend. Because we are in a position to have both the aggregation of services that we have on our platform, because we are able to pull in point solutions, because we are able to help navigate digitally on our platform, we have evidence that that is working within our TPA book of business. So for those organizations that have the full stack, meaning the well-being platform, navigation, care management, and TPA services, that book of business is running 4 to 6% lower than those that are just having our TPA service. This is the start of moving the needle on health versus healthcare. So for us, this is really where we're leaning in. So our platform engages more than any other service in the world. We're engaging on average 51% of the population. They're coming back 19 times per month, and there's at least 6 interactions within the app in order to have an interaction. So for us, that's frequent. And there is an impact as we start to think through the reduced risk. So there's a behavioral health component that is really strong. 5 out of 10 people are indicating lower stress levels. As we think about where we are from a behavioral perspective, this is where the Personify effect comes into play. We heard from one of our behavioral health point solutions that when they run their program in conjunction with our engagement platform, they are seeing a higher enrollment of 45% and a higher engagement of 41%. That is meaningful, and that's because people keep coming back to the platform for different use cases, and we have the intelligence behind the scene to serve up exactly what they need. From a clinical outcome perspective, this is really where you start to think about risk factors and emerging risk and moderate risk. We have an advantage here as well. And this is where we've been able to demonstrate that for 7 out of 10 members, we've been able to reduce the risk at least 1. And for those that have 5 or more risks, so think your high expensive, chronic, complicated cases, we've been able to reduce 3 or more risks for 50% of those individuals. So it does come back to an effective use of the platform, which is driving productivity, which is driving actual results from an ROI perspective. So for all of us, we're the largest in the industry. We drive the most engagement. And I think the question is, why would we want to change? We want to change because we believe that we can elevate where we are as an organization. We believe that we can change the trajectory of health so that it has meaningful outcomes on the overall health and spend of populations. And as we think about all the engagement that we're going to be driving, it's going to start being more focused as we head into next year. I'm incredibly excited for all of you to hear about the innovation and see some of the demos that we are developing at this point. There will be a transition from engagement to clinical outcomes, and that will have a direct impact on overall health and spend. So when I think about what we have in front of us, there are a couple thoughts. First, if employers continue to buy healthcare the same way they have for the past 10 years, they're not going to have a different outcome than they have the past 10 years. And secondly, for me, the next decade will not be defined by who pays for the care. It's going to be defined by who improves health. We believe that we are uniquely qualified to drive that strategy moving forward. And if we step back and ask, hey, what is this that you're creating? I view it as almost a health operating system. So it's something that's continuously running in the background, looking for signals, connecting data, bringing in wearables, looking at claims. And as we think about that operating system concept is something we're all very familiar with. It runs on our phones, it runs in our cars, it runs in our businesses, but it's not running for the one item that is most valuable to all of us, our health. That's still running on very segmented programs on a fragmented system. It doesn't make any sense. So for us, having that continuously running operating system behind the scenes that can adapt for every individual as they go through their life is going to be absolutely essential. So for us, as we think about that, there are going to be 4 areas that we focus on. And as we think about our position in the market and our opportunity to have all this data, how do we connect it without it being super complicated? So how do we use the claims data? How do we use labs? How do we use wearable data? How do we use all the things at our disposal in order to create a very, very precise view of that individual? We believe that the future of this health operating system starts with that connection. It won't be discrete apps, but it will be more intelligent integration. So as we think through that, the next component is that we will have engagement that sparks change. And that engagement is something we already have a head start on, but we think we can get better. We think we can start to look at emerging and moderate risk differently and start to intervene. This will talk about a new user experience, a new way that we're thinking about behavioral engagement. There's a whole lot that we're working on that's going to bring the next generation of Personify to the fore, and that engagement will result in change based on the longitudinal clinical innovation that we're going to bring through the platform. Thirdly, we need to have that operating system running in the background to continuously personalize the experience for each individual user. Nothing can be done at a peanut butter level or at a program level. It has to get down to that individual level. So we're incredibly excited to share a glimpse of what that next generation personalized experience will look like and how we bring point solutions and other partners into that experience in a new and dynamic way. So as we think about AI, and this is kind of the first time that I'm talking about it, that's going to be running in the background. But as we think about that moving forward, we will always couple that with an empathic human as we combine that data and the experiences with the care managers, the coaches, or whoever that person needs in that moment. And then finally, for us, the proof's going to be in the pudding. The impact, as we think about it, it's going to be outcomes, not just engagement. We're going to be looking at better health, lower cost, improved experiences. And the future of healthcare will go well beyond measurement of a singular ROI. We'll have to look at risk reduction, health improvement, and the overall human experience. Because the ultimate proof isn't engagement. It's getting people healthier. And as we think through all of these things, how all these things come together, we're incredibly excited to show you where we're headed. And then finally, I invite all of you to start thinking about where we are. We have an opportunity to create a system that finally works for everyone. With that becomes the notion that we are all human and we are all in a pursuit of health. And I think it back to the lessons and the effort my dad made in order to present health and healthcare and access points in a way that an individual can consume. That's exactly what we're building today. So I ask you finally, what is your why? And what will you do starting today to help build a better future for you and for health? Welcome to Thrive. Thank you.